international development is shifting, and that affects the way that international groups like RTA do business. How does that play out in a program such as the one that you currently do in South Sudan on HIV/AIDS?
Yes, it is shifting. The paradigm is shifting, and we have actually the main change is that the resources are remaining the same, are not increasing, but the needs are increasing because of population growth, because of pandemics that are growing. At the end of the day, any healthcare, it is one patient, one provider, one caretaker. That's what it is. And if you don't have enough providers to deal with the large number of people needing care, if you don't have a system that can supply reagent drugs or any medical supplies, if you don't have a system where we can have health facility that people can come in a safe environment to seek for care and treatment, that will be the main limit. So how do this work out? How do we address this? We have to be more efficient in our use of resources. So what we bring is, we have to put our resources, what we can do is bring our top experts to work with South Sudanese organizations, both governmental and non-governmental organizations, and train them, equip them to address the pandemics of HIV/AIDS, both in the preventative side, but also in the treatment and care side.
So what I gather is that the way that RTI does business with this health program, for instance, in South Sudan, is different than how you would have done it maybe years ago. You don't set foot so much in the country. You have partners over there, and then you work with your advisors in the region in order to create plans and tools, set them up for success.
Yeah. Exactly, and collect data tools. Yeah, exactly. It's really, it's a different way, which is probably the future of development. That we should be, working with people from the countries and getting them ready to deliver the service.
Are all organizations equipped to do that, or what does an organization have to do in order to play that role in the future?
I think that probably what's happening is there is a differentiation of the roles of responsibilities. International organizations will have to have a value proposition, and we cannot compete, replace, substitute local organizations, government or non-governmental. We should bring something that they don't have, which essentially is expertise, know-how that has been built for over many years in scientific environments. This know-how, this expertise, is what can international organizations bring to countries to help them reduce poverty, fight against HIV/AIDS or other pandemics or Ebola. But at the end of the day, service will be delivered by host countries. So that's the main change probably.